The alarming revelations about the Countess of Chester Hospital paints a disturbing picture of a healthcare system in crisis, a deadly bacterium, systemic failures, and a suspected serial killer within the same neonatal unit culminated in a perfect storm, exposing vulnerable infants to imminent danger. However, new evidence leaked to the Telegraph in the UK shines a spotlight on a previously overlooked and under investigated threat in the neonatal unit. Around the time of the murders and attempted murders, there was an outbreak of Pseudomonas aeruginosus within the Counties of Chester Hospital's neonatal unit. Before we take a look at that, I want to express my gratitude to all of you who have shared your thoughts. Your insights are invaluable and your feedback help to steer the direction, hence this video that you're seeing. So keep the comments coming. Today's video does offer new clues, but I think it's essential to remember that this is an ongoing investigation and there is a public inquiry into the Lucy Letby case, and a little bit more on that later on. For now, let's turn our attention to this report from the Telegraph, which sheds new light on events. The report leaked to the Telegraph revealed the presence of a deadly bacterium known as Pseudomonas aeruginosus in the neonatal unit at the Countess of Chester Hospital. The bacterium can be fatal to vulnerable infants and notably was present between 2015 and 16, coinciding with the period that Lucy Letby is accused of causing infant deaths. According to the Telegraph article, the bacterium Pseudomonas aeruginosus had colonised taps in the nursery of the neonatal unit, including the intensive care area. I'll put a link in the description below to the Telegraph article. What I've found out is that there is little data on the prevalence of this bacterium and outbreaks across UK neonatal units, but there was an outbreak at the Royal Jubilee Maternity Hospital in 2012. This resulted in the deaths of 3 premature babies. The bacterium is obviously non-trivial and is quite life-threatening. In the case of the Royal Jubilee Hospital, it was sink taps that were identified as the source of infection. And of course, we all know there was an outbreak at the Countess of Chester Hospital. Certainly from the research that I've done, preventing and controlling this bacterium within neonatal units is difficult and only highlights the vulnerability of these infants and the critical importance of robust prevention and control measures. There are several reasons why this bacterium is so dangerous to premature infants. For a start off, they have an underdeveloped immune system, and that makes them highly susceptible to infections. Their skin, of course, is very delicate, and the mucous membranes provide a very easy point of entry for bacteria. Further, intensive care units themselves, while necessary, they are also a breeding ground for bacteria, especially if infection control measures are inadequate. Another issue is, of course, medical interventions like intubation and the use of catheters, which can also increase the risk of infection. These measures are very necessary to keep the infant alive. And finally, this particular bacterium is often resistant to multiple antibiotics, complicating treatment. These factors can combine to create a perfect storm for premature infants, leading to severe life-threatening infections such as sepsis, pneumonia, and meningitis. David Livermore, Professor of Medical Microbiology, said that from mid-2015 to mid-2016, there were 17 infant deaths at the Counties of Chester Hospital unit. He goes on to say that we are asked to believe that this comprised of 2 superimposed clusters, one of 7 babies murdered by Lucy Letby, and one where, to quote the Crown prosecution expert, they died from the usual problems, why small babies die, hemorrhage, infection, and congenital problems. He goes on to say that it's simpler to believe that we're looking at a single spike of fatal infections in a chaotic unit. So what Professor Livermore is saying here is that we've been asked to accept a complex scenario of 2 overlapping groups of deaths. One group, according to the prosecution, involves 7 murders committed by Lucy Letby. The other, according to the expert witness, comprised of typical infant fatalities due to hemorrhage, infection, or congenital issues. A simpler explanation is that we're witnessing a concentrated period of fatal infections within a chaotic ward environment. The risk report leaked to the Telegraph shows that the counties of Chester Hospital had been dealing with this bacterium since May 2015. Despite no recorded infections among newborns in August 2015, the risk assessment for the bacterium at the Countess of Chester Hospital was then lowered. However, this decision proved premature, as positive tests for the bacterium were detected in the intensive care unit and in another baby ward by December of the same year. According to the Telegraph article, the infected tap in the intensive care unit was replaced, but resource constraints prevented the immediate replacement of the contaminated tap in other wards. This meant that the hospital was forced into using filters as a temporary solution, certainly a less than ideal situation. In response to the outbreak, the Countess of Chester Hospital instituted robust infection control protocols. The measures included limiting visitors, treating all infants as critically ill to mitigate the severe threat posed by the bacterium. Despite rigorous testing and monitoring of the water supply, the hospital acknowledged the ongoing risk of contamination, and this from the US Centre of Disease Control and Prevention reinforced this concern, warning that the bacteria's often subtle symptoms can mask the severity of infection in newborns. The CDC went on to inform the Telegraph that this particular bacterium is associated with high mortality rates during an outbreak. Neonatal intensive care patients often have defects in their immune system and are often subject to large amounts of very intensive care, which makes them very susceptible to infections within a healthcare setting. When infected, there's a high risk of adverse outcomes, including death and severe infection. As neonates have little capacity to compensate for additional stresses, infection can cause other problems in these patients that are not directly related to the infection. Clearly, the Lucy Letby case has revealed shocking conditions at the Countess of Chester Hospital. At the first trial, the defence team argued there was significant drainage issues at the ageing hospital building. Letby herself previously described the neonatal unit as a hazardous environment due to the frequent sewage overflows and inadequate hygiene facilities. She suggested these conditions could have contributed to infant deaths. Evidence presented in court also highlighted severe plumbing issues, including an incident where human waste from an upper floor seeped into the neonatal intensive care unit. A plumber with over 3 decades of experience at the hospital corroborated Lucy Letby's claim of poor sanitary conditions. In giving evidence, Letby told the jury that parts of the neonatal unit were not a safe working environment because there were often plumbing issues. Letby goes on to say that we used to have raw sewage coming out of the sinks and often coming onto the floor of the nursery. It's a contributory issue if the unit is dirty and the staff were unable to wash their hands. Letby said the plumber testified that the hospital's women and children's building, constructed in the 1960s, suffered from chronic drainage problems. The defence team did quiz the plumber and asked about the frequency of these sorts of issues during 2015 and 16 time period in question. The plumber responded that he was called out to address plumbing issues for the whole building, maybe weekly. The plumber then went on to corroborate Lucy Letby's account of sewage overflows incidents in the intensive care unit. However, he clarified that based on his records, this was an isolated occurrence addressed through subsequent maintenance work. While the plumber mostly confirmed Lucy Letby's version of events in terms of the sewage incidents, he was unable to provide a specific date due to the absence of formal records on the hospital's data tech system. For any hospital, the lack of records on this is certainly a dangerous oversight. In the year 2016, there were 11 other plumbing incidents in the building where Letby allegedly murdered babies. The plumber clarified under cross-examination by the Crown Prosecutor Nick Johnson KC that approximately half of the identified problems occurred in the labour suite and there was no consequence in the neonatal unit. So where does that leave us? Well, the Crown has ordered a public inquiry which has been led by Lady Justice Thirlwell. She and her team will re-examine the events at the counties of Chester Hospital between 2015 and 16. The Thirlwell inquiry will focus on three specific areas, and what I have here is taken directly from the inquiry website. So I encourage you to have a look yourself. I'll leave the link below in the description. Part A of the inquiry is about the experience of the hospital and elsewhere of the parents of the babies named in the indictment. And remembering, of course, that by law, infants cannot be identified by name and are given a pseudonym like a letter of the alphabet to protect their privacy and the privacy of their parents. Part B considers the conduct of the people working in the hospital and how Letby was able to repeatedly kill and harm babies in the neonatal unit. Part C will look at the wider NHS system, examining the relationship between the various groups of professionals, the culture within the hospitals, and how those affected the safety of newborns in the neonatal unit. The other point I want to touch on briefly, of course, is Operation Hummingbird. The Cheshire Police launched Operation Hummingbird to conduct a broader investigation into the circumstances surrounding the infant deaths. This includes examining potential corporate manslaughter charges against the hospital trust as well as other charges. It's time to wrap this up. The revelations at the counties of Chester Hospital are deeply disturbing. The combination of a deadly bacterial outbreak, a nurse committing heinous crimes, creates a complex and tragic picture. While the focus has been on Lucy Letby, the hospital's systemic failures in infection control and maintenance are equally alarming. The Thirlwell inquiry will explore these issues to prevent future tragedies. We must understand how such a catastrophic breakdown in patient safety could have occurred. The families of the victims deserve justice, and you, the public, deserves accountability, both in terms of the hospital system and, of course, the convictions against Letby. While opinions are divided, your opinions are invaluable. So please continue to leave your thoughts in the comments section below. Stay updated with our latest updates on the Lucy Letby case and its broader investigation and, of course, ongoing implications. Hit the subscribe button and notification bell to be the first to know when we release new content. Together we can demand justice for all. But for now, take care.